So the Center for Youth Wellness is a health organization located in Bayview, Hunters Point, and we work with the Bayview Child Health Center, and together we implement an integrated system of care, and we screen and treat children and adolescents who are exposed to adverse childhood experiences. An adverse childhood experience is a stressful or traumatic event that happens to children and infants and adolescents before the age of 18. It could potentially have very serious consequences throughout childhood and in adulthood. So there's been tremendous research that's been done that really demonstrates how ACEs can be very harmful. And so we really believe in prevention and getting ahead and addressing both ACEs and toxic stress before those long-term outcomes occur in adulthood.
When we punish kids for their poverty, the toxic stress goes unaddressed. What we don't need is increased punishment. What we do need is increased care.
H2O Productions is a multifaceted organization that is particularly concerned with empowering youth to impact the material conditions of their communities. We do that through knowledge of self, extensive research, as well as we create a very community-based, family-oriented structure that supports youth through their academic endeavors.
Youth, they are experts in their own experiences. They understand what they're going through. Some of our partners mentioned that sometimes they don't have the words to identify with what they're doing, but we can come in and support with the research end, but they're there to provide us information and expertise on their reality.
I was able to learn about the different research methods and all the different vocabulary that I never even knew was involved with doing research. So it's been a very cool learning experience, and it has also helped me explore public health, which is now something I'm really interested in.
Today, my project is about assessing resources to prevent and treat trauma and stress in San Francisco.
We as student researchers helped add 17 additional adversities to the original ACE survey. Adversities that include things that happen at home or in the community or at school.
The big question that we're all wondering is what now? We could share this knowledge and hopefully spark the brain that will create the change.
I'm all about social change. I'm all about creating better communities for people that live in their own communities and create spaces to where youth can actually express themselves, because if youth can't express themselves and open up, then how do we understand them? How do we know what goes on in their minds? And I see myself in the future being a part of something like that.
Youth who come to the Bayview Child Health Center, they get asked questions about stressful experiences that are relevant to them. Otherwise, we wouldn't be able to understand a whole potential host of experiences that they might be suffering that could affect their health. So working with the youth has really made our work much more relevant, which could make it very important for preventing outcomes later on.
I think what's been so essential in our partnership with the Center for Youth Wellness is we've been given the language to particularly diagnose the unique kind of suffering that our youth are experiencing. Right, a suffering of what happens when we do not create the conditions by which all youth can be successful and healthy and thriving. And that's the language of ACEs and toxic stress.